Okay, good day, nurses. Today, we're going to discuss your anti-gout agents. But before we're going to dwell or we're going to start with the discussion of your anti-gout agents, we need to first understand the concept of your inflammation. Okay, pag sinabi kasi natin inflammation class, it is a response, okay, to tissue injury caused by the release of your chemical mediators. Okay, so what are these chemical mediators? Of course, we have here three, at least three chemical mediators, no? That is actually indicated or included during the process of your inflammation. First, we have your histamine, your kinins, and your prostaglandin. So pag sinabi kasi nating histamine yan, class, your histamine is definitely the very first chemical mediator, no, that is being released in response to a tissue injury. Okay, so anong ginagawa ng ating histamine? It usually causes, okay, vasodilation. Okay, it causes vasodilation to our arterioles. So ano ba yung mga arterioles natin? They are your small arteries natin. Wherein, as a result of your vasodilation of your arterioles, nagkakaroon pa ng increase in fluid in the specific area. Okay? And aside from that one, we also have here your kinin. An example of your kinin, we have your bradykinin na tinatawag. Okay, we have your bradykinin. So, ang ginagawa ng ating bradykinin, it also increases your capillary permeability natin. And of course, it also increases yung mismong sensation natin to pain. Yan po yung ginagawa ng ating kinin. And lastly, we also have here your prostaglandin natin. So your prostaglandin as well, it also causes vasodilation. Okay? And aside from that one, it also causes, tawag dito, relaxation of your smooth muscle, of course. And of course, it also increases your capillary permeability. And of course, alam naman natin when we discuss already your prostaglandin in your NSAIDs, your prostaglandin increases mismo yung sensitization ng ating katawan or ng ating mga nerve cells into pain. So these are your three chemical mediators that are being released during the process of your inflammation. Ulitin natin, ang ating inflammation, this is just the response, no, of our body to tissue injury caused by the release of this chemical mediators. Wherein, once na-release yung ating mga chemical mediators, it will definitely trigger both your vascular response and migration of your fluid in our cells. And always remember, class, ha, actually your process of inflammation, no, that is just, salat natin dito, this is just a protective mechanism ng katawan natin. Okay? Ang inflammation, this is just a protective mechanism of our body in which our body actually attempts, no, to neutralize and mismong destroy yung mga harmful agents that are actually indicated or involved in your inflammation, no, wherein at that site of injury, mas nagkakaroon po tayo or mas na-establish ng katawan natin yung mismong tissue repair na tinatawag. This is just a protective mechanism of our body. Okay, so let's discuss your tissue injury. Okay, sabi natin kapag nagkaroon ka ng tissue injury, of course, nagkakaroon ng release of your chemical mediators natin. Wherein, sabi natin, no, meron tayong cardinal signs of your inflammation. We have 5 cardinal signs of your inflammation. But before we're going to discuss that one, alam naman natin na meron tayong una. Okay, once na-release yung chemical mediators natin, what will be the result? Sabi natin, it will dilate your arterioles natin. Nagkakaroon ng dilation of your arterioles. Wherein, kapag nagkaroon ng dilation yan, of course, ang unang manifestation or ang pinakaunang cardinal sign of your inflammation, it's your redness, your rubor, or your erythema. Bakit po nagkakaroon ng redness? Of course, redness, sabi natin, this is actually the first phase of your inflammation. Wherein, nagkakaroon ng redness or erythema, it's because nagkakaroon ng accumulation of your blood in that area of your tissue injury. Okay, nagkakaroon ng blood accumulation or blood congestion. Okay, accumulation in the area of that site of injury or area of the tissue injury. Okay? And aside from that one, nagkakaroon din po ng increased capillary permeability. Okay, nagkakaroon ng increased capillary permeability wherein it will result to what? Swelling or your edema or your tumor. Sir, bakit po nagkakaroon ng swelling? Of course, it's because yung mismong plasma natin no, nag-leak po sila into our interstitial tissue at the injury site. Okay, wherein nagkakaroon po ng fluid and cell accumulation on that specific area of injury. Okay, and then of course, another effect of your release of your chemical mediators in our body, nagkakaroon tayo ng increased sensitization to pain. Bakit po nagkakaroon ng pain? Of course, yung ating mga nerve endings or your nerve cell, nag-increase po yung sensitization nila sa pain because of your possible swelling. Okay, and aside from that one, of course, nagkakaroon ka ng fever. Bakit nagkakaroon ka ng fever? It's because of what? It's because your, your heat at the inflammatory site can because of your what? Increased blood accumulation that will result to, heat. Bakit nagkakaroon ng heat? It's because of your pyrogens na tinatawag, di ba? I know for the fact that you've already discussed kung ano yung pyrogens na yan. We're in these pyrogens, okay, these are actually substances that produces your fever, di ba? Okay, wherein it actually interfere dun sa mismong temperature regulating center in our brain. Ano ba yung temperature regulating center in our brain? It's your hypothalamus. Okay, and that is your tinatawag na 5 cardinal signs of inflammation. 5, sir, bakit 4 lang naman yan? Sir, meron pa pong kulang. Of course, sabi natin the last phase of your inflammation, kapag nagkaroon ng tinatawag na what they call this one, edema or swelling or tumor, and of course, pinag-combine mo yan together with your pain, it will result to your loss of function. Bakit nagkakaroon ng loss of function, sir? It's because of the accumulation of fluid at the tissue injury. And of course, sabi natin, it's because of that pain. Therefore, kapag nagkaroon ng swelling, nagkaroon ng pain, it will definitely what? Decrease yung mobility at that affected area. That will result to loss of function. So that is your the cardinal signs of your inflammation. What is the irrelevance of this one, sir? Bakit importante po na malaman po natin yung mismong process of inflammation natin? It's because you will not be able to understand yung mismong concept ng anti-gout agents natin kung in the first place, hindi po natin alam yung mismong pathophysiology ng ating inflammation na tinatawag. Okay, so let's proceed now with your gout. Okay, pag sinabi kasi natin gout, that is actually an inflammatory disease of your joints, no? And other tendons or other tissues of our body. What is usually the reason kung bakit tayo nagkakagout? Okay, in the first place, meron tayong tatlong klase ng arthritis natin. We have your osteoarthritis, we have your rheumatoid arthritis, and of course, we also have your gouty arthritis. Ngayon, ang number one culprit or ang number one cause or etiology kung bakit ka nagkakaroon ng gouty arthritis, it's because of your hyperuricemia. Ibig sabihin ng hyperuricemia, masyadong mataas ang uric acid serum level in our body. Yan pong ibig sabihin ng hyperuricemia natin. And we all know that your uric acid, okay, always remember this one, this is just the byproduct of your purine metabolism natin. Your uric acid is the byproduct of your purine metabolism natin. Ang nangyayari kasi kapag hyperuricemia class, nagkakaroon yan ng uric acid accumulation, no, in your joints, in your tendons, and other parts of your body. Okay, so of course, kailangan nating malaman kung ano po yung mga purine rich containing foods natin or yung mga merang mataas na concentration of your purine. Kasi di usually, tawag dito sila talaga yung isa sa mga nagkakos kung bakit ka nagkakaroon ng hyperuricemia that will lead to your gouty arthritis. So what are the purine containing foods natin? Of course, number 1, we have your organ meats. Next, we also have your sardines, no? Your salmon, it's not salmon, di ba? Your gravy, your herring, your liver, and your meat subs. And of course, your alcohol, particularly yung beer natin. So these are foods that have a high concentration of your purine that needs to be avoided kapag meron ka ng gouty arthritis. Okay? Ang nangyayari kasi class, kapag sa gouty arthritis, so nagkakaroon talaga ng defect when it comes to your purine metabolism. Okay, pag nagkaroon kasi ng defect with your purine metabolism, it will result to high levels of your uric acid in your body or yung tinatawag natin na hyperuricemia para magkaroon ka ng acute gouty attacks or mag-exacerbate kapag meron ka ng dating gouty arthritis. Okay, and aside from that one class, okay, tandaan natin, no, saan usually, when we are going to discuss the predisposing factors of your some of these are just precipitating factors kapag pagkain yan, di ba? As part of your lifestyle, pwede siyang ma-modify. Pero, kapag predisposing yan, they are non-modifiable factors. Like, for example, mas mataas ang risk ng mga kalalakihan to develop your gouty arthritis. It's because of your gender. Male, bakit, sir? Of course, mas mataas yan kasi males, in general, eat lots of protein and of course, mahilig silang uminom ng alak. Okay, that is why if you're going to discuss the predisposing factors of your mas mataas ang kanilang ang risk for them to develop kapag lalaki ka. Okay, and of course, usually, no, yung mga gouty arthritis natin, they can actually, natitrigger po sila na during cold weather. Okay, so that is your natin. Purine-containing rich foods, or purine-containing foods, or these are the foods that have a high concentration of your purine. Ngayon, ang nangyayari kasi class, kapag gouty arthritis yan, no, usually, sabi natin, nagkakaroon ng infiltration or accumulation of your macrophages, okay? Or yung mga macrophages natin in your joint space natin. Sir, saan po usually, what part of our joints usually nagkakaroon ng swelling during your flare-ups of your gouty arthritis? Number one, very common parts of our body, we have your hallux or halux or your great toe. Okay, we also have your fingers and even with your earlobes po. Diyan po usually nag-infiltrate or nagkakaroon ng site or yung mismong site of inflammation natin during flare-ups of your acute gouty arthritis. Ngayon, usually yung mga macrophages natin, of course, in response kapag nagkaroon yan ng possible problem, di ba? Usually naman as part of your protective mechanism or defense mechanism ng katawan, papadala niyo yung mga macrophages natin mismo dun sa ating mga injured site natin or inflamed site natin. Ngayon, ang gagawin kasi ng mga macrophages natin, class, they are going to phagocytize. Ibig sabihin phagocytize, kakainin po nila yung ating mga uric crystals. Ngayon, wherein these are just the results of your high level or accumulation of your uric acid. Nagkakaroon pa ng crystallization or nagkakaroon pa ng presence of your uric crystals at that inflamed joints natin. Ngayon, pag kinain po ng ating mga pag kinain niya ng ating mga, what do you call this one? Ng ating mga macrophages, yung ating mga uric crystals natin, nagkakaroon po ng release ng ating or secretion of your interleukin 1 beta. Wherein, di ba alam naman natin na ang ating gout is actually disease driven solely by your interleukin 1 beta. Wherein in response yan sa natin, sa mismong tawag dito, mga uric crystals natin, which forms during your hyperuricemia. Kaya marerelease po or masasecrete po yung ating mga interleukin 1 beta wherein it will result to inflammation. Okay, it will result to inflammation wherein yung mga sodium na uric crystals natin, yun na po yung tinatawag natin na kung saan sila nag-accumulate sa ating mga hallux, sa ating fingers or earlobes. Yun po yung mga tinatawag natin na topay or yun pa yung parang bukol, no? That is your topay na tinatawag. For example, sa hallux ka nagkaroon ng hindi ko kasi siya malagyan ng illustration here kasi hindi siya ma-edit, hindi siya ma-move. Okay, so try ko na lang i-illustrate, i-drawing. Ngayon, pag nagkaroon ka kasi ng topay class, for example, yung hallux or hallux natin or yung mismong hinlalaki natin sa paa. Okay, for example, ito yung paa mo, for example. Magkakaroon siya ng bukol na ganyan. Okay, this is your thumb. Pangit yung drawing ni sir. Okay, ganyan. Nagkakaroon siya ng bukol-bukol. Just try to search on your internet yung mismong itsura ng topay natin. So that is your gouty arthritis natin. Nagkaroon ng problem sa ating urine metabolism. Nagkaroon ka ng, kasi pag nagkaroon ka ng problem with your urine metabolism, it will lead to accumulation of your uric acid. Okay, so let's proceed with our medications or your anti-gout agents. Nakalagay dito, no, your anti-gout agents, they usually act on purine metabolism natin. Yan po ang ginagawa ng ating mga anti-gout agents natin. So actually, we have 3, no, na klase ng anti-gout agents natin. We have your mga anti-inflammatory gout agents natin, we have your uricosuric, and of course, we have your xanthine derivatives na tinatawag. But then these two are just very common. No? They are widely being used to treat symptoms or to treat mismo yung ating gouty arthritis. Kaya we have here your colchicine. Usually, ang colchicine natin class, they are just being used for, nakalagay dito, they are just being used during, okay, acute gouty attacks. Okay, ginagamit po natin ang ating colchicine during your acute gouty attacks natin. Ngayon, ang ginagawa po ng ating colchicine, they inhibits the migration of your leukocytes or your WBCs papunta sa ating inflamed. Wherein na-discuss natin yan kanina na nagkakaroon ng infiltration, nagkakaroon ng accumulation or migration of your WBC sa mismong injured site natin. Ang ginagawa po ng ating colchicine, binablock niya po yan. Okay, and then of course, kapag na-block po yung mismong migration ng ating, or na-block po mismo yung mga leukocytes natin papunta sa ating mga injured site, of course, wala na pang inflammation. Therefore, it will alleviate your gouty symptoms natin. That is why it is being used to treat your acute gouty attacks. Yan po ang ginagawa ng ating colchicine. The downside of your colchicine class, okay, compared sa other anti-gout agents natin, it does not, nakalagay dito na side notes natin, it does not inhibit, okay, always remember this one, it does not inhibit your uric acid synthesis or increase its secretion. Ibig sabihin, wala pong kakayahan yung colchicine natin para mag-decrease ng uric acid level serum natin. And of course, wala po siyang kakayahang tumulong para ma-excrete yung uric acid natin in our urine. Okay, basta tandaan nyo lang, ibig sabihin ang ating colchicine, ginagamit lang po natin yan to decrease yung mismong gouty symptoms natin or your inflammation. Yan lang po solely ang kanyang action ng ating colchicine. So what is the very common side effect of your colchicine? Okay, number 1 is GI distress. Always remember this one, class. Okay, your GI distress is the most or the common side effect of your gouty arthritis or of your colchicine. So therefore, alam naman natin na kapag it causes GI distress, ano ba yung mga symptoms or signs ng GI distress natin? We have your nausea, vomiting, abdominal pain, or whatsoever. You need to administer this medication with food. Okay, kailangan po nating i-take yung ating colchicine with food. That will be your instruction to your patient. So what are the contraindications of this medication? Number 1, we have here, of course, you have to take caution or you have to take precautions when you are going to administer this type of medication. Okay, number 1, kapag si patient meron siyang severe renal, cardiac, or GI problems. Okay, but still, they could still take this medication, but of course, to the help of your assessment. Okay, and of course, the laboratory values that you need to assess or you need to closely monitor bago tayo magbigay ng colchicine natin. So that is your colchicine. On the other hand, we also have here your allopurinol natin. Ngayon, pag sinabi nating allopurinol class, okay, pag sinabi kasi nating allopurinol yan, ang kanyang classification, this is actually a xanthine. Okay, xanthine, I'm so sorry. Okay, this is a xanthine oxidase derivatives today, I'm so sorry. Xanthine oxidase inhibitor. Okay, xanthine oxidase inhibitors. Okay, that is the classification of your allopurinol natin. So, malalaman natin later on kung anong mismong function ng ating xanthine derivatives. Okay, ang action kasi, or ang indication, ang action talaga, ang mechanism of action of your allopurinol, it decreases your uric acid synthesis natin, di ba? Compared sa ating colchicine kanina. And of course, it prevents gouty attacks, not for acute or present attacks, but it is being used for chronic topicious gout. Or ibig sabihin, yung mga meron na talagang gouty arthritis na nagkaroon na ng exacerbation or na-trigger lang natin. Yun po yung gamit ng ating allopurinol. Kapag meron na silang chronic topicious gout already. And of course, it can use also for patients with renal impairment or blockage. Okay, kasi ano yan class, tawag dito, kapag nagkaroon ka ng what do you call this one, nagkaroon ka ng problem with your stones or nagkaroon ng formation ng mga stones natin, that is your lithiasis, no? So kapag ganun, pag nagkaroon ka ng urolithiasis or urolithiasis, you can actually use your allopurinol para ma-break natin yung mga stones na form for them to be excreted in our body. Okay, that is your allopurinol. Okay, sabi natin, ang kanyang action talaga, class, it usually inhibit your xanthine oxidase enzyme. Sir, ano ba itong xanthine oxidase natin? Okay, the xanthine oxidase enzyme class, it is actually, of course, an enzyme, no? Okay, that what? That helps during purine metabolism para magkaroon po ng ating para ma-form po natin yung ating mga uric acid. Yan po yung ginagawa ng ating xanthine oxidase xanthine oxidase enzyme natin. It helps with the conversion from urine to the formation of your uric acid. Wherein your uric acid is one of your, di ba, yan yung main culprit natin. Bakit ka nagkakaroon ng gouty arthritis? So, binablock niya po yung mismong action or function ng ating xanthine oxidase inhibitor. Ngayon, pag na-block mo yung mismong action ng ating xanthine oxidase enzyme natin, magkakaroon ka pa ba ng accumulation or increase of your uric acid serum level? Of course, hindi na po. Okay, therefore, it will decrease your uric acid production natin. Kasi yun naman talaga yung action ng ating allopurinol. It works with your uric acid synthesis. It also helps with the excretion of your uric acid synthesis. Pinapababa na nga lang niya ang ating uric acid, pinapadali pa niya ma-excrete ang ating uric acid in our urine or in our body. Okay, that is your allopurinol. Ngayon, we have here yung iba't ibang side effects natin. We have here your dizziness, of course, your headache, dry mouth, and of course, ito very common, your GI distress. And aside from that one, also your arthralgia or your joint pain. Sir, bakit? Sabi natin kanina, ginagamit natin yan to decrease or to alleviate your gouty symptoms. Bakit possible magkaroon ka ng sir, ng arthralgia? It's because, dapat class, kapag bago tayo magbigay ng anti-gout agents, we need to know kung dati na ba siyang merong gout. Kasi kapag allopurinol yung una mong binigay, possible, pagkakaroon ka ng exacerbation of your gouty symptoms. Mas maganda na colchicine mo nang ibigay mo, of course, to relieve the inflammation itself, bago ka magbigay ng allopurinol para malaman natin kung nagkakaroon ba ng problem with your uric acid synthesis natin. Ganun po yun, okay? And of course, you have here your pruritus pag nangangati. And of course, your ED. Anong ibig sabihin ng ED? That is your erectile dysfunction. Okay, your ED is your erectile dysfunction. So, it usually affects your younger males po natin. Okay, so aside from that one class, we also have here your bradycardia, your hyperglycemia as well. So, of course, kapag yung patient natin, kapag merong diabetes, alam naman natin kapag diabetic yung patient natin, mataas ang kanilang blood glucose level or blood sugar nila. So, therefore, you have to take this you have to administer this medication prior giving it. Dapat meron kang assessment kung okay ba ang kanilang blood sugar, kasi it can actually contribute para mas tumas yung blood sugar nila, which is not good kapag merong diabetes si patient natin, di ba? So, kailangan mo talagang i-assess muna yan. And aside from that one, also it can result to blood dyscrasia because it affects all your blood cells. And of course, we have your SJS, that is your Stevens-Johnson syndrome. Stevens-Johnson, I'm so sorry, si Sir Steve tuloy na sabi ko, no? Stevens-Johnson syndrome natin. So, you have to search kung anong Stevens-Johnson syndrome natin. And of course, it will also result to what? Kidney stones. Okay, bakit sir? Kasi, tawag dito, alam naman natin for the fact that your, what do you call this one? Your, uric acid class, nagkakaroon kasi yan ng crystallization, and usually your uric acid, they cannot withstand yung mismong acidic environment ng ihi, therefore hindi po sila na-excrete kapag ganun. Okay, so mas maganda that we need to alkalinize yung mismong ihi natin by how, sir, you should not be advising your patient to take your vitamin C, of course, acid yan. It will further contribute to the mismong crystallization ng ating mga or formation of your kidney stones. So, aside from that one, nakalagay na dito sa interventions natin. Of course, as part of your assessment, you have to record your urine output kasi kailangan natin makalculate yung mismong uric acid level ng ating patient kapag meron silang sakit. Of course, it will also serve as your baseline data para ma-compare natin kung nakatulong ba siya dun sa mismong problem natin or hindi. Okay, aside from that one, of course, you have to monitor, you have to monitor your lab tests for renal and hepatic function kasi sabi natin, both of this medication, you need to administer it cautiously kapag meron silang hepatic or renal impairment. Of course, your BUN or your blood urea nitrogen, yun dapat ang i-monitor natin. And aside from that one, you have to instruct your patient to increase the fluid intake, of course, to increase yung mismo drug and uric acid excretion natin. And lastly, you have to Advise your patient to have a yearly examination. Bakit, sir? Usually, class, your allopurinol can cause actually visual disturbances. So, of course, as part of your assessment, after nila mag-take ng allopurinol or after nila makomplete yung mismong course nila, when taking this kind of medication, you have to, tawag dito, to evaluate kung nagkaroon ba ng visual disturbances yung patient natin. So, that's it for your anti-gout agents. Thank you for listening.